talk the utility of Rani scoring. Utility of Rani scoring in a management club foot in children. So Rani scoring is a scoring system that is developed by the Dr. Shafiq Rani. It is not a classification. It is a score, which means that the foot needs to score at every visit. As the foot deformities get corrected, the score will change over the period of time. It has been validated for the children up to the age of 1 year, infancy childhood age, because it is not applicable when the child will wear or walk. Also, it has been shown have an excellent inter and intra-observer reliability. So, what is the need for a scoring club foot? So, as an outset of treatment, it is necessary to know the severity of deformity. Secondly, then during the course of treatment, it helps us to monitor the response of the treatment. It helps us to make important decisions like when to move on the next treatment, when the treatment is finished. So, in a cases where the resistance relapse cases, it helps us to identify its earlier stage. So, there are 6 signs in Rani score which change as a club foot correct with the ponseti method. So these consist of the 3 midfoot signs, midfoot deformity signs, curved lateral border, uncovered lateral head, talar head, medial crease, and 3 hindfoot deformity signs, namely the empty heel, rigid equinus, and posterior crease. So each sign assigned a score either 0, 0.5 or 1, which means we can have a total score 0 in completely corrected foot and 6 in a completely uncorrected foot. So let's take up each sign one by one. So firstly, come to the midfoot sign, midfoot deformity sign. The first midfoot sign is the medial crease. If there are multiple fried crease along the medial border of foot, score assigned is 0. And a single shallow crease which depth is visible, given score is 0.5. And a single deep crease with depth is not visible, given a score of 1. So these are the clinical picture of grade 1, in which in the first picture there are fine creases or no creases, that is the score is 0 here, and in the single shallow crease in second clip, which depth is visible, that is the score given is a 0.5, with single deep crease with the depth is not visible. This is a score of 1. For a reference, we can use you can look at the thumb. If at the thenar eminence border, there are simple shallow creases that presents our score 1. It is the thumb is in a flex extended position. That's at DIP joint, interphalangeal joint. That represent score 5, and when the thumb is flexed in the deep crease and the interphalangeal joint, that represent 1. So coming to the second sign of midfoot, that is a curved lateral border. Lateral border foot completely straight, that is a score 0. A gentle curve gets a score of 0.5. The boomerang curve gets a score of 1. So in this, to study this objectively, you can place a ruler or pencil at the lateral border of the foot throughout. Then it gets a score of 0. On other hand, the forefoot deviates from the scale at the tarsometatarsal joint. Then score is 0.5. The foot deviates medial even more proximally. Then foot gets a score of 1. The third midfoot sign is the uncovered lateral talar head. To assess this sign, to palpate the talar head by the first palpating the lateral pelvis, then move ventrally to feel the talar head. With other hand, hold the forefoot and abduct the forefoot, so the talonavicular joint is maximally reduced. In maximally reduced position, how much of the lateral border of the talar head remains palpable? So the talonavicular joint completely reduced, then the talar head will completely disappear and will not be palpable by the tip of thumb. And that's a get a score of 0. If there is a partial reduction of reduction, your thumb will palpate some part of talar head and gets a score of 0.5. Another hand, if a talonavicular joint is completely is reduced, you can feel uncovered tailor head, that's a get a score of 1. So here are the clinical picture, different rate and palpation method of uncovered tailor head. In picture 1, there is a normal foot where you can't feel the tailor head, and that is a score is 0. In second pic, there is a partially uncovered head, that's a score 0.5, and in third picture there is a totally displaced tailor head from the naviculum, so that's gets a score of 1. Hindfoot sign is empty. Hindfoot first sign is empty heel. It is done by dorsiflexing the ankle with one hand, and tip of index finger of other hand you try to feel for the calcaneal tuberosity through the corner of the heel. So hard monituberosity is palpable under the skin, gets a score of 0. For the reference, you should be palpating like a forehead. That is a hard. That is a forehead. If on palpation you can feel the subcutaneous fat, but disappear. But a deeper palpation able to feel the tuberosity, gets a score of 1.5. This would be palpating your tip of nose. That is a form. On other hand, there is a thick pad of subcutaneous fat, not able to palpate the tuberosity. It would be the soft like a thinner eminence. So that's a get a score of 1. So here the originally the Prani describe only 2, 0 and 1. Later on it is extended. So you have to feel at not at the bottom of the foot or posterior side of leg, just at the 45 degree of angle with the index finger. The posterior crease sign is somewhat similar to the middle crease. So there are multiple frank creases, gate score of 0. If there are single shallow crease, that's a gate score of 0.5, and a single deep crease, that gets a score of 1. So these are clinical pictures that are depicting the score of 0, 0.5 and 1. In the picture 1, there is a multiple shallow, multiple creases or no crease, there is a score 0. In a single shallow crease with the that is done by dorsiflexing the ankle passively in the position, assessing the angle between the fibula and lateral border of the foot. So if you call palpation, the flexion, you are able to dorsiflex above the 90 degree, that's a get a score of 0. And if you are able to dorsiflex till 90 degree, that gets a score of 0.5. If you are not able to dorsiflex even in 90 degree, that's get a score of 1. So here example of 3 gates. In a picture 1, there is a good dorsiflexion beyond 90 degrees, so that's a get a score 0. In picture 2, there is a dorsiflexion of at the ankle to the 90 degree, that is a score of 0.5. And not it is a beyond the 90 degree in that picture 3, third picture, that is a score of 1. As I mentioned, like the Prani score needs to be documented at every visit, and looking for how the Prani scoring chart is progressing, it helps us to make the important treatment decisions. For example, what should be the timing of TA tenotomy? So look at this graph here. You can see the onset of the treatment. The Prani score was 6. The 3 for the hind foot and 3 for the midfoot. As the treatment progress, the midfoot score gradually is come down by the 5th class. It has reached to 0. However, the hindfoot deformity is failed to correct. And therefore, at this point where the midfoot score reaches the 0, and but the hindfoot is almost 2.5, that is the timing when you should perform the tenotomy. So tenotomy was performed at this stage. As you can see in this chart, after that the hindfoot score also came down to 0. So the deformity was fully corrected. So Prani score graph helps us to assess what should be the appropriate timing for your TA tenotomy. It also helps us to identify any problem during the casting phase. For example, you can see in this chart, in this graph, the Prani score 6 progressively decreased till 3rd cast, but in 4th cast you can see there was an increase in Prani score. And this indicates that there might have been some problem in previous cast. Might have been some class slippage, or might not have been appropriately, cast was might not have been properly applied. So this kind of blip in a graph alert the surgeon to the potential problem and should alert to take remedial steps. Prani score graph also help us to identify whether you are possibly dealing with a syndromic foot. For example, you can see over here, the Prani score remained static for a very long period of time. Normally it ends after in the 5 to 6 cast, you should see the correction, at least midfoot deformity should come to 0. But in this case, both the hindfoot and midfoot deformity have failed to correct. So in this way, this indicate and alert the surgeon to the possibility that he may be dealing with either a syndromic or neurogenic clubfoot or atypical complex clubfoot. So in a summary, the Prani scoring, 2 points for the field, the lateral head of talus, empty heel, 2 points for the measure, rigid equinus and lateral curve border, 2 points to look for the medial crease and posterior crease. It should be recorded at every visit, including at the bracing stage also. It is a best done in a child in a comfortable position, sitting on his mother's lap.